Thank you for listening to Depictions Media Radio.
Alors, bonjour tout le monde. Good afternoon. Today, I am joined by my colleagues, Minister Haidu and Minister Blair, and by Dr. Tam and Dr. Njoo. Last night, the Prime Minister held the 25th call with Canada's First Ministers to discuss their shared response to COVID-19. The Prime Minister reiterated to his colleagues our government's commitment to supporting provinces and territories, and also to supporting Canadians during the difficult pandemic. Les premiers ministres ont également discuté de l'importance d'éviter tout voyage non essentiel, tant qu'au pays qu'à l'étranger, et de renforcer les mesures de contrôle aux frontières pour les personnes qui reviennent de voyage. Now is clearly not the time to travel. Stay close to home. We know the pandemic is not easy. It's been extraordinarily difficult. But together, as Canadians, we will come through this. I would now like to ask my colleague, Bill Blair, the Minister of Public Safety and Emergency Preparedness, to say a few words. Bill?
Well, thank you very much, Minister LeBlanc. First of all, I'd like to begin by thanking everyone for joining us today. Fighting the ongoing pandemic remains the Government of Canada's top priority, and we will continue to take strong action to limit the spread of COVID-19 in our country. That includes providing support to the provinces and territories. And from the very beginning, we have been very clear. From the very beginning, we have been in regular contact with our provincial and territorial partners to assess the needs of the hardest hit regions and to provide support that will help protect the health and safety of Canadians going forward. And today, we are building on that support with an important announcement. As the Prime Minister said a short time ago, the Government of Canada will deploy 2 federal mobile health units to the Greater Toronto Area. And this is in response to a request that we have received for assistance from the province of Ontario. These units will be staffed by the province and have facility for up to 100 beds in each of them. They will provide additional hospital beds and facilitate the transfer of non-critical care patients out of critical care to ensure that these specialized resources are available for those who will need it the most. And this will help relieve pressure on Ontario's strained hospital capacity due to the prevalence of COVID-19 in the province of Ontario. We will continue to work with our provincial and territorial partners to assess the need for similar units elsewhere in the country. The Government of Canada has also been providing support to the provinces and territories through federal surge capacity support. That includes laboratory and testing assistance and equipment, and help with contact tracing and funding for voluntary self-isolation sites. In response to requests for federal assistance, we've also provided support to improve the situation in long-term care facilities in both Ontario and Quebec. In Quebec, as you'll recall, members of the Canadian Armed Forces provided assistance last year at 47 long-term care facilities, primarily in the hardest-hit regions of Montreal, Laval, and Montérégie. The Government of Canada also provided funding to support the transition from the Canadian Armed Forces to the Canadian Red Cross. And Red Cross teams continue to provide assistance in long-term care facilities in Quebec and will do so at least until March 31st and as long as they are required. The Ontario government, in Ontario, the Government of Canada has deployed 275 members of the Canadian Armed Forces last spring to provide support in 7 long-term care homes in that province. And that deployment ended at the end of June when the province indicated that their situation had stabilized. In response to subsequent requests for federal assistance, we have provided funding to support the Canadian Red Cross operations in 27 long-term care homes across Ontario, and they will remain in place until March 31st or as long as they are required. The Government of Canada has also approved a request from Manitoba last November for federal assistance for long-term care facilities. And in response to that request, we worked with the Red Cross to support its COVID-19 response efforts in LTCs in Manitoba. I would also note that members of the Canadian Armed Forces were deployed in December to the Shamattawa and Red Sucker Lake First Nations in Manitoba and arrived this week in Garden Hill First Nation to help fight the spread of COVID-19 in those communities. We know that the need for relief and assistance continues to be of great need and concern across the country, and we are standing by to provide additional support to our partners, including the provinces and territories, as required. Let me also take this opportunity, if I may, to reiterate that Canada has implemented some of the strongest border measures in the world. Temporary restrictions remain on optional and discretionary travel right across all of our borders. We will continue to strongly advise Canadians against travel abroad unless it's absolutely necessary, and to be very clear, it is not the time to travel now. Those who do travel must now go through the extra step of getting pre-departure tests before they can return back home. And it's important to note that this does not replace the required quarantine period. Quarantine has been and continues to be our most effective measure, and it remains mandatory. We have scaled up the presence of border services and public health officers at our border to ensure that people understand their quarantine obligations to verify their quarantine plans. And we are working with the provinces and territories to ensure that there is follow-up and enforcement of those quarantine requirements. The vast majority of Canadians have been very responsible in adhering to the quarantine requirements. But unfortunately, some do not follow the rules, and there needs to be follow-up, enforcement, and consequences for those who choose to put others at risk. No matter where you're coming from or how you enter Canada, and unless explicitly exempt, you are required to quarantine for 14 days upon your arrival, and compliance is essential. If you break the rules of quarantine, the penalties could be severe, up to 6 months in jail or up to $750,000 in fines. But perhaps more importantly, the consequences of putting your family, your friends, and your community at risk are things that I think all responsible Canadians should take very seriously. As all COVID-19 decisions, including those related to the border, continue to be made with the health, safety, and security of Canadians as our most important and overriding priority. And as always, we'll continue to work with all of our partners, the provinces and territories, and use science and evidence to inform all further steps to keep Canadians safe. Thank you very much, and I'll return to you, Dominic.
So thank you very much, Bill. And now we're going to ask Dr. Tam and Dr. Njoo to say a few words, and finally we'll conclude with our colleague, Minister Hajdu. So over to you, Dr. Tam.
And bonjour à toutes et à tous. There have been over 731,000 cases of COVID-19 in Canada, including 18,622 deaths and over 67,000 active cases across the country. Nationally, an average of 6,080 new cases have been reported daily over the past week. There continue to be high numbers of people experiencing severe illness. There are an average of over 4,650 individuals with COVID-19 being treated in Canadian hospitals, 870 of whom are in critical care, and on average, 149 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory reports 31 cases of the B.1.1.7 variant that was first identified in the United Kingdom, and 3 cases of the B.1.351 variant that was first identified in South Africa. From now on, we're going to be referring to the scientific nomenclature of these variants. As the rollout of COVID-19 vaccines proceeds across Canada, federal, provincial, and territorial authorities are working closely together to monitor vaccine safety. As of January the 15th, there have been 90 reports of adverse events following immunization. These include any health problems that occurs following immunization, but is not necessarily caused by the vaccine. 27 of these reports, that is 1 in 22,000 doses distributed, were considered serious, such as a severe allergic reaction. All serious events undergo a detailed investigation. To date, no unexpected vaccine safety issues have been identified. Although national daily case counts have been trending down in the past 10 days, daily case counts are still elevated and regional fluctuations in disease and outbreak activity continue. This gives us hope that community-based control measures are starting to take effect, but it is still too soon to be sure that these measures are strong enough and broad enough to set us on a steady downward trend. Likewise, as severe outcomes will continue to lag behind increased disease activity, we can expect to see ongoing heavy impacts on our healthcare system and health workforce for weeks to come. Recalling our trek down the curve of the first wave, we talked about the need for caution to avoid pitfalls that would stall or reverse our progress. This time, the way down is even more complicated, with much higher daily case counts, more affected areas across the country, the emergence of new virus variants of concern, and stretched and exhausted healthcare capacity. On this even trickier path, we know that the same certainty as the last time, that if we ease up too soon or too quickly, resurgence will be swift and strong. Every day we are one step closer and better times are ahead, but there is no fast track. We must stick with public health measures and individual practices that we know are effective for controlling spread. Unless and until infections rates are low enough to allow public health authorities to test, trace, and isolate effectively, easing of restrictions risks even stronger resurgence. This is why we must all continue to do our part to slow the spread, and that means postponing vacation travel to a better time in the future, avoiding, shortening, or limiting outings and activities to just the essentials, and maintaining hand washing, masking, and spacing to limit opportunities for the virus to spread. This is the tough part of the COVID-19 marathon, but together it will be easier. Thank you.
Bonjour à toutes et à tous. Jusqu'à maintenant, il y a eu plus de 731 000 cas de COVID-19 au Canada, dont 18 622 décès, et il y a actuellement plus de 67 000 cas actifs au pays. À l'échelle nationale, 6 080 nouveaux cas ont été signalés en moyenne tous les jours au cours de la dernière semaine. Le nombre de personnes présentant des symptômes graves demeure élevé. En moyenne, plus de 4 650 personnes atteintes de la COVID-19 sont traitées dans les hôpitaux canadiens, dont 870 se trouvent dans des unités de soins intensifs et en moyenne, 149 décès sont signalés chaque jour. Le Canada continue de surveiller l'apparition de variants préoccupants de virus. À ce jour, le Laboratoire national de microbiologie signale 31 cas de variants détectés initialement au Royaume-Uni, le variant B117 et 3 cas de variants détectés pour la première fois en Afrique du Sud, le variant B1351. Nous utiliserons dorénavant la nouvelle nomenclature de ces variants. Alors que le déploiement des vaccins contre la COVID-19 se poursuit dans tout le Canada, les autorités fédérales, provinciales et territoriales travaillent en étroite collaboration pour surveiller l'innocuité des vaccins. En date du 15 janvier, il y a eu 90 déclarations de réactions indésirables suivant l'immunisation, sur ce qui comprend les problèmes de santé qui surviennent après l'immunisation, mais qui ne sont pas nécessairement causés par le vaccin. De ce nombre, 27 réactions, ce qui représente environ 1 cas sur 22 000 doses distribuées, ont été jugées graves, comme une réaction allergique grave. Toutes les réactions graves font l'objet d'une enquête approfondie. Jusqu'à présent, aucun problème imprévu lié à l'innocuité des vaccins n'a été déclaré. Bien que les chiffres quotidiens nationaux soient à la baisse depuis 10 jours, le nombre de cas quotidiens demeure élevé et nous observons toujours des fluctuations régionales pour ce qui est de la transmission de la maladie et de l'apparition d'éclosions. Cette situation nous donne à espérer que les mesures de contrôle communautaire commencent à porter leurs fruits. Cependant, il est encore trop tôt pour affirmer avec certitude que ces mesures sont assez efficaces et suffisamment étendues pour nous permettre de maintenir une tendance à la baisse. De même, comme nous continuerons de constater des complications graves après l'augmentation de la transmission de la maladie, nous pouvons nous attendre à observer de façon continue de lourdes conséquences sur notre système de santé et sur l'effectif du secteur de la santé au cours des semaines à venir. Gardons à l'esprit que nous avons réussi à faire chute la courbe de la première vague. Nous avons parlé de la nécessité de faire preuve de prudence pour éviter de tout faire stagner ou d'aller à l'encontre de nos progrès. Cette fois, il est encore plus compliqué de faire chuter la courbe, étant donné les nombres de cas quotidiens beaucoup plus élevés, le plus grand nombre de régions touchées à l'échelle du pays, l'apparition des variants préoccupants du virus, ainsi que l'épuisement des travailleurs de la santé dont la capacité est mise à rude épreuve. La lutte est cette fois encore plus difficile et nous savons avec la même certitude que la dernière fois que si nous relâchons nos efforts trop tôt ou trop rapidement, la recrudescence sera rapide et forte. Chaque jour, nous sommes plus près de temps meilleur. Toutefois, il n'y a pas de façon rapide. Nous devons nous en tenir aux mesures de santé publique et aux pratiques individuelles que nous savons efficaces pour contrôler la propagation. Tant que les taux d'infection ne seront pas suffisamment bas pour permettre aux autorités de santé publique de dépister, de rechercher et d'isoler les cas de manière efficace, l'allègement des restrictions risque d'entraîner une recrudescence encore plus forte. C'est pourquoi nous devons tous continuer à contribuer au ralentissement de la propagation. Cela signifie de reporter nos voyages de vacances à un moment plus favorable, d'éviter ou d'écourter nos sorties et nos activités ou de les limiter à l'essentiel et de continuer à nous laver les mains, à porter un masque et à respecter les principes de distanciation pour limiter les possibilités de propagation du virus. Nous en sommes à la partie difficile de la longue lutte contre la pandémie de Covid19. Ensemble, nous la mènerons plus facilement. Merci.
Alors, merci beaucoup, Dr. Njoo. So, Patty, over to you.
Well, thank you very much, Dominic and colleagues. Good afternoon. Every time that you decided to stay home this week, you helped protect our healthcare workers and hospitals. And over this past week, over 50,000 people have canceled their flights and postponed travel. Thank you so much for protecting each other. Less travel means less risk for everyone. Aux Québécois et aux Québécoises, merci de respecter le couvre-feu comme vous le faites. Vous aidez à protéger les travailleurs de la santé et les hôpitaux. I encourage you to keep going and to continue to follow public health advice. While our government is working to get you vaccines as soon as possible, you can continue to make a difference. You can continue to save lives. And you make a difference by wearing a mask when you need to go out and by getting tested when you have symptoms. Remember, if you have any symptoms, even if mild, stay home, isolate, contact your local public health unit to ask about testing. And download the COVID app if you still haven't. Please keep sharing credible resources to help your close ones have access to the right information on COVID-19 and vaccines. We update Health Canada's website regularly with new information, and just this morning we added a new chart on the number of vaccines administered across the country. Now, as Canadians, we know that winter is difficult, but good things are happening because Canadians really are helping each other. More people are receiving their COVID vaccine. But as Dr. Tam and Dr. Njoo have pointed out, we still have to keep pulling together. Now's not the time to let down our guard. Keep reaching out to vulnerable people in your communities and think about the resources that you can use or tell your friends and family about to take care of your mental health, like wellnesstogether.ca. And mark your calendar to join the conversation on mental health next week for Bell's Let's Talk Day on January 28th. Thank you very much.
Merci beaucoup, Patty. Alors, ça nous fera plaisir, évidemment, de prendre les questions.
Bonjour, merci à tous. Nous allons donc procéder à la période de questions. Nous allons prendre des questions au téléphone aujourd'hui. Chaque journaliste a le droit à une question et une question de suivi. We will now move on to questions on the phone. Each reporter can have one question and a follow-up question. To the ministers and the doctors, a reminder to put yourself on mute when you're not answering a question. Opérateur, première question.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. And our first question, la première question est de Rachel Haynes from CTV. Please go ahead, la parole est à vous.
Hi, ministers and doctors. My first question is for Minister Blair about travel requirements and international travel. Are you considering stricter enforcement measures and quarantine measures when people return from international travel? As Dr. Tam mentioned, there are now 31 cases of the UK variant here in Canada, and today, even out of the UK, Boris Johnson is saying that this variant is more fatal. So does that cause some concern and make you think that you need to have increased measures when people arrive?
Rachel, thank you very much for the question. It's an important one. And yes, we are concerned with the variants, and it's one of the reasons we've taken already some fairly significant steps in requiring all international travelers to submit to a pre-departure test within 72 hours of their departure to Canada. That measure has now was put in place in direct response to the concerns about the variant. But we are also examining all measures, and I will tell you simply, nothing is off the table. We're looking at taking whatever steps are necessary to protect Canadians. And we're looking at a range of options to strongly disincentivize. We have issued a number of significant advisories urging Canadians not to travel for discretionary purposes. But unfortunately, we have seen, and I think Canadians are quite understandably concerned, that some people are choosing to go on their spring break trip or to continue.
Merci, thank you. Opérateur, prochaine question, next question.
Thank you. The next question, la prochaine question est de Boris Proulx du Devoir. Please go ahead. La parole est à vous.
Oui, bonjour. Ma question s'adresse à M. Leblanc. Concernant les voyages non essentiels, le gouvernement du Québec a menacé en quelque sorte de recourir à un plan B, c'est-à-dire de mettre en place lui-même une quarantaine obligatoire à l'hôtel, comme ce que fait la Nouvelle-Zélande. J'aimerais savoir si le fédéral considère que c'est une bonne idée et si il y a des discussions pour implémenter cette idée à la grandeur du pays.
Nous sommes en discussion continuelle avec des experts en santé publique, des forces de l'ordre, le ministère de la Sécurité publique, mais aussi nos partenaires dans les provinces pour voir comment nous pouvons renforcer les mesures pour les arrivants des voyages, par exemple des vols de l'international. On a pris connaissance des commentaires de M. Legault. J'ai parlé moi-même, j'ai eu une discussion constructive avec la ministre Sonia Lebel du gouvernement du Québec. Et comme j'ai dit, le Conseil des ministres est saisi actuellement avec une série d'options pour renforcer et les mesures de quarantaine et les mesures de dépistage potentiel aux arrivées. Et nous aurons des précisions au cours des prochains jours, mais nous voulons absolument travailler avec le gouvernement du Québec, mais nous reconnaissons que le gouvernement fédéral peut à tout moment, comme le premier ministre Trudeau a dit à plusieurs reprises, augmenter des mesures de protection, et c'est exactement ce que nous allons faire au cours des prochains jours, et on aura des précisions littéralement au cours des prochains jours, et c'est une série d'options qu'on peut utiliser ensemble pour renforcer la posture aux frontières internationales.
D'accord, mais en suivi, j'aimerais quand même avoir plus de précision. Est-ce que c'est envisageable qu'une seule province mette en place ce genre de mesures-là et que ailleurs au pays, on continue avec la méthode traditionnelle, celle qui est en place actuellement?
Évidemment, c'est mieux si on a les mêmes mesures, par exemple, aux 4 aéroports qui ont été désignés pour recevoir des vols de l'international. Il y a des vols qui arrivent à Montréal, à Toronto, à Calgary, à Vancouver. Le gouvernement de l'Ontario, j'ai parlé avec le premier ministre Ford à quelques reprises cette semaine et en fin de semaine, lui privilégie la question de faire des tests de dépistage pour tout le monde à l'arrivée aux aéroports. On a pris connaissance des commentaires de M. Legault. Alors, nous sommes tout à fait d'accord à prendre des mesures pour renforcer les frontières internationales, mais nous allons prendre ces décisions basées sur les meilleurs avis des experts, des scientifiques, et des responsables de la sécurité publique.
Merci. Thank you. Prochaine question. Next question.
The next question, la prochaine question est de Mia Rapson from the Canadian Press. Please go ahead. Your line is open.
Hi, this is a question for Dr. Tam. There have been a couple of new treatments for COVID-19 that have either been approved or even promoted by Health Canada recently. One of them, a blood thinner treatment. I believe that I'm just curious if Health Canada has any guidance on the use of blood thinners, as well as another drug that was approved and started shipping out in December. I'm just wondering if you can talk about these new treatments and how you think they can help the pandemic and how they should be used.
Yes, I think it's really great that there's more and more evidence on treatments. Health Canada, of course, is a regulatory authority that approves treatments. But we are, I think, really relying on our clinical experts who are on the ground treating patients. So the clinicians who are treating patients have to decide what's best for them. So I think, and they will sort of look at the individuals in question to, figure out what is really in their best interest. I think the ones that I'm familiar with that have been utilized very widely to this point are things like dexamethasone that is used for hospitalized patients, which is an anti-inflammatory. I do know that some of the effects of COVID-19 involves an impact on your blood vessels or inflammation, and so I think it would depend on the clinical guidance at this point.
Okay, thanks. And for Minister Blair, you've talked a lot about, you said you're not delaying these decisions about the border, and you're talking about the testing that is required and the flight ban. But with all due respect, we know people got around the flight ban simply by flying through the United States from the United Kingdom and came in. And we've been told for months that testing is just a moment in time. So having a test 3 days before you get on a plane doesn't mean that 10 minutes after you got the test, you didn't suddenly contract COVID-19. So I'm just curious. And we also know now that these variants are not just circulating from travelers, but they're circulating in the community. So I'm curious how you expect Canadians to believe that we're really protecting us against these variants when the measures that are being put in place clearly have not worked.
Yeah, thank you very much for the question. And first of all, let me reassure you and Canadians that for those individuals, when we put the flight restrictions in prohibiting flights from the United Kingdom in response to the variants that emerged there, we also took steps to ensure that those people who chose to fly from the United Kingdom into the United States and then transit through the U.S. to Canada were also identified through screening by our border service agents. They were referred into Secretariat and they were referred to PHAC for further follow-up and quarantine measures because we recognize that loophole. And I've already spoken about the efforts and the discussion that's taking place with our American colleagues to address that potential vulnerability that exists because the measures that they've put in place do not align clearly with our own. I think what I want to make perhaps most clear is that we are quite open to adding additional layers of protection and imposing additional measures. Nothing is off the table, as I've said, and we are considering a very wide range of additional options that can be imposed. But I think it's equally important that we fully utilize the value of the most important tools that we've already put in place. And I'll go back to what I believe is perhaps the best protection is the quarantine order that the Public Agency of Canada issues for all arriving travelers. And compliance with that order is critical to keeping Canadians safe. The police of jurisdiction, and I listened very carefully to Premier Legault yesterday when he spoke about how effective the police of jurisdiction in Quebec, the Sûreté and the municipal police services like the SPVM, were in enforcing the lockdown orders that the province imposed. And I would also highlight that we need more enforcement from the police of jurisdiction in areas where that's the RCMP. The RCMP have that responsibility. But in the vast majority of places, certainly in Ontario, Quebec, the police of jurisdiction are in fact the municipal or provincial police service is in place. They have the tools available to them to enforce the compliance with the quarantine orders. And I think that enforcement is also going to be important. And so it's part of an ongoing discussion that we're having with our provincial and territorial partners to ensure that the tools that we have available to us that we know are effective to keep communities safe need to be fully utilized, because Canadians have to understand there are real consequences, not just to their health and to their families and their communities, if they break the terms and conditions and requirements of quarantine, but there can also be legal consequences as well. And I know the police have been somewhat reluctant to use the enforcement tools that are here, but it's necessary. And so we're having discussions with the RCMP, but also with other police jurisdictions through their provincial and territorial authorities to ensure that the tools that we have are fully utilized. And as I've indicated, we are also working with our international partners, with the provinces and territories, to add additional tools and requirements that we can put in place to provide that health assurance. You know, we've got a light at the end of the tunnel. The emergence of a vaccine and the exceptional work that is taking place to administer that right across the country it offers us, I think, a reason for real hope. But we have to ensure that we take the measures now to get through this period. And you know, we have all been trying to encourage Canadians to be responsible, to stop traveling for discretionary purposes, you know, to take the steps necessary for those who are returning Canadians, and they have a right of return, but we want to make sure that they do so safely. And so we will continue to put in, you know, layers of protection and control to ensure that the new variants are not brought into this country, and that we deal with them responsibly. And as I've also indicated, we know that the illness, as was said earlier, is already present in our communities. And so we have to make sure, working with our provinces and territories, that we take the steps necessary to protect Canadians, to ensure that our hospital capacity is not exceeded, that we do the work necessary to protect people in long-term care facilities or other vulnerable populations. We're working with our provincial and territorial partners to do all of those things, and we'll continue to work hard. We need Canadians to remain vigilant and careful as well, and that's what we're urging people to do.
Merci. Thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
The next question. La prochaine question est de Daniel Blanchette-Pelletier de Radio-Canada. Allez-y, la parole est à vous.
Bonjour, ma question est pour Dr Tam. J'aimerais savoir quelle est la cible de couverture vaccinale que le Canada a identifiée pour atteindre une certaine immunité collective. Est-ce qu'on parle de 70% ou plus 85% de la population? Les avis divergent là sur le sujet.
Bonjour. Je vais commencer, mais peut-être Dr. Njoo va ajouter quelque chose aussi. Mais le cible n'est pas vraiment connu maintenant. Les experts constatent que peut-être c'est entre 60 à 75%, mais ça dépend de connaissances à l'avenir aussi, parce que ne sait pas encore connaît l'efficacité de vaccin pour réduire la transmission de virus. Ça, c'est la première question. Donc, pour l'autre considération est que si il y a de nouvelles souches de virus qui est beaucoup plus transmissible, on a besoin peut-être plus haut niveau de vaccination pour protéger la communauté. Peut-être Dr. Njoo va ajouter quelque chose.
Bon, merci Dr. Tam. Pas beaucoup de choses à ajouter. Je pense qu'on peut dire que la situation est toujours fluide avec l'épidémiologie, comme Dr. Tam a constaté. On ne sait pas exactement c'est quoi peut-être l'impact des variants préoccupants du virus ici, parce que ça continue, le virus continue à avoir des mutations avec la pression quand on a commencé déjà avec la vaccination de la population. Ça, c'est un facteur. Aussi, on ne sait pas avec les programmes qui commencent maintenant à vacciner les Canadiens, mais l'efficacité du vaccin dans un essai clinique, c'est pas la même chose que l'efficacité de vaccination dans le monde réel avec les populations. Donc, on continue à analyser les données probantes pour l'efficacité de vaccination actuelle ici au Canada, mais aussi à travers le monde. Il y a aussi des expériences des autres pays qui, je pense que c'est très important de ramasser, peut-être échanger des données probantes pour voir qu'est-ce qui peut nous informer pour c'est quoi la couverture peut-être vaccinale optimale pour avoir la comité d'immunité à l'échelle de la population. Merci.
Et en sous-question, bon, je comprends qu'il peut y avoir un seuil minimal qui pourrait aussi être beaucoup plus élevé selon tous ces facteurs-là. Est-ce que vous pensez que peu importe quelle va être la cible que le Canada va finalement identifier, on peut réellement l'atteindre? Et je ne parle pas ici en termes de doses de vaccins disponibles, mais plutôt en termes de volonté de la population à se faire vacciner.
C'est Dr. Njoo, peut-être moi je peux commencer. Oui, je pense que c'est un enjeu important. C'est vraiment pour, renforcer, augmenter la confiance des Canadiens dans les vaccins. Je pense que la plupart des Canadiens sont très, optimistes et aussi encouragés par qu'est-ce qu'on a commencé avec la vaccination. Donc, je pense que c'est important de continuer d'être transparent avec nos communications. On a déjà constaté aujourd'hui, même les effets peut-être secondaires, peut-être qui suivent une vaccination, mais pas nécessairement liés à la vaccination. C'est important aussi de faire une enquête aussi pour communiquer avec les Canadiens pour être vraiment transparent. Et jusqu'à date, il n'y a vraiment pas des événements préoccupants, mais on continue de travailler étroitement avec les provinces et territoires pour ramasser les données probantes. Je pense au futur, je pense qu'avec l'expérience, avec le plus de Canadiens qui seront vaccinés, je pense que ça va encourager les autres Canadiens à être vaccinés. Je pense que vraiment le but reste toujours le même, c'est d'offrir au moins la vaccination à tous les Canadiens pour qui les vaccins sont recommandés. Hein, et c'est vraiment le but de peut-être avoir le plus grand nombre de Canadiens vaccinés d'ici la fin du mois de septembre.
Merci à tous. Thank you, everyone. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui. Merci.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.